Anytime, my friend. My step there. All right, my friend. Anytime.
Everyone. Great. Well, then you know that we're across Michigan, and we do it like love.
The Michigan Roundtable does its work in 3 core areas. 1, with our youth empowerment work. 2, with our cultural competency work. And the 3rd area is in a broader community engagement work. Our mission means we help make organizations where people work and communities where people live places where everyone is valued, everyone's welcome, everyone's included.
A lot of times when we're doing this sort of work in communities, what we find is that young people they understand that they care about these issues, but they don't always have the language to talk about it. So we really start at a foundation of identifying some of that language.
We were exposed to a whole bunch of different races and a whole bunch of information that those races had to offer. And if I were to go back, I'll let them know about the stuff that I learned from them.
Ever since I've been going to Michigan Roundtable, it's really opened my eyes to all these different forms of privilege and oppression, and I've really learned so much from it.
We work with these school groups to develop those skills, and then they work throughout the year on a campaign or on a project to teach people in their community, teach other young people some of the things that they've learned in our program, and try to create school spaces that are more inclusive for all young people.
Good afternoon, everyone, and welcome to Diversity Awareness. My name is Rita Crooks, and I am the manager of cultural competency for the Michigan Roundtable.
Well, Henry Ford Medical Group has 1,200 physicians and 4,000 employees, and we have a number of doctors from around the world and employees from various diverse backgrounds. So it's pretty clear that in our environment we're dealing with diversity among our employees on a regular basis, and the Roundtable clearly provides that kind of sensitivity training for our employees to ensure that we in fact are able to get along, work well together, and create some of the efficiencies we'd like to have as a system.
Our work, this is not always a topic that we seek out. Nobody wants to see themselves as intolerant, and sometimes we don't recognize our difficulties.
More companies need to come around and take advantage of this opportunity. Many have, Henry Ford Health System certainly has, but as we get more and more interest in this, I think they'll see the gains.
When we come into communities, we gather the stakeholders to imagine what that community might look like, what an inclusive community might look like. And those citizens then work with the town, the leaders of the community.
One of the things that we have done from the beginning is sort of move out of the congregations into the neighborhoods and really be in the community and do that so that we can all learn more about the community, what's good about the community, as well as what do we think needs are issues that we want to address in the community.
There is fresh food in Detroit. There is good meat in Detroit.
We work also in regions, and we work statewide. Currently with the Riverfront East Community Project, working to drive on assets and using that to make that a more livable and welcoming community. So the First Friday Forums are a place for the community to come together to understand the myriad ways in which race impacts our life.
As you overlook what's really taking place in the state of Michigan.
People are coming out on a Friday night where they have many other options to do many other things. But they're here because they have an opinion, they have a thought, they have a passion or a desire or a willingness to know how to do things differently or better. It's critical to hear other thoughts. It's critical to know what it is that people are sensing and feeling so that we, as an organization, can get some sense of how we should move forward and the kinds of programming that we should do, the kinds of directives that we should take based upon what the community says is critical.
The passion of the employees is unmatched.
I have the privilege and pleasure of working with some extraordinary young people across Metro Detroit.
mission has always been unity. The Round Table has always been there trying to address the problem. And the Round Table has been probably the most effective organization in doing that throughout Detroit's history.
Our mission takes intention, that takes leadership. And we help bring the leadership together with the citizens. We help bring organizations together with their employees to make it a place they want to work and live well.